Together, we are unlocking potential. Welcome to this episode from Red Door Pediatric Therapy, where we share stories and strategies of functional, behavioral, emotional, and social development in children today. We're glad you're here, and we can't wait to get started.
Good morning and hello, friends. Welcome back to Unlocking Potential. I'm Stephanie Schneider, your host. Today, my guest is Jorden Beckman. Hey, Jorden.
Hey.
Welcome. Jorden, she is a speech language pathologist at Red Door, and she is just the perfect guest for our topic today because she is interested and experienced in sound development, articulation, and basically anything going on in the mouth, which is more than one would think, right, Jorden?
Yes,
Lots going on in there. But today we are focusing on something that speech therapists see a lot of and parents ask questions a lot about. We're going to talk about lisps today. So let's start there. We'll dive right in. Jorden, tell us, what is a lisp?
There's a couple different types of lisps, actually. There's a frontal lisp and a lateral lisp. So a frontal lisp is when the tongue comes forward against or between the front teeth, typically when you say S or Z. So it makes it sound like a TH, like this. Sun instead of sun. And then a lateral lisp is when the air flows out the sides of the tongue instead of the center. So the sides of the tongue aren't raised up high enough to make the air come forward. It results in like a slushy, wet sound, more like a done sound. Lisps are typically a result of a placement error of the tongue, like we just talked about, that results in a distortion of the sound that they're trying to produce. So like I said, it can be S and Z. Sometimes it's with some palatal sounds as well, like the SH or the CH or the J sound.
Okay, so not just the S and Z sound can happen to all of those other ones. So that's quite a list, S and Z, and then what did you say, SH, CH, kind of that just sound. So if they're having all of those distortions, how does that impact their intelligibility or how well others understand them when they're talking?
Yeah, sounds impacted by a lisp, like we've talked about, they occur very frequently in English. S is the fourth most frequent sound, and Z is the seventh most occurring sound in our conversations that we have typically. So it can impact the clarity of the speech and lead to a communication breakdown. It's maybe not as impactful as like totally deleting a whole sound, like it's not even in the word, like you've said, un instead of sun. That would be more impacting your intelligibility, but it can definitely impact the clarity. Sometimes it sounds like a TH if you're using a frontal lisp. So if you said, I wash my hands in the think is also a real word with your brain. So sometimes there can be a breakdown there with the meaning of the word is different if the placement of the sound is different.
Yes, I suppose especially too for people who aren't as familiar like with your speech, like your mom and dad hear you talk all the time and they probably know what you're saying, but people in the community like neighbors or the person at the grocery store or whatever probably impacts more too. Yes. Okay, so let's talk about mom and dad and caregivers. I guess we're always the ones thinking about our kids and thinking about development and listening to them talk. When should they become concerned if they're hearing these sound distortions or these lisps?
A lateral lisp you're going to be more concerned about earlier just because that airflow out the sides of the tongue is never typical. So typically about age 3 is when we would start to work on that awareness of the sides of the tongue and that forward airflow for that lateral placement. And then about age 4 for that frontal lisp. We really want that tongue starting to retract in the mouth, stay behind the teeth instead of coming forward between those teeth.
Do you think parents are surprised by those ages? Like those seem pretty young to me.
Yes, I would think. I mean, there's a lot of kindergartners in school, that have a lot of speech sound errors that we would maybe work on earlier in a private practice than we would in a school. There are just different levels that they can qualify kids on too based on age.
So I had a kindergartner this year and a first grader this year, and May is always filled with field trips and things like that. So I get out and try to experience some of those. And yeah, you see a lot of 5 and 6 year olds, and I'm always listening and watching them speak too. And there's definitely kids who are lisping at that age in those classes that I even saw during those experiences. And I don't think I heard any with the arrow up the side, those lateral ones, but definitely those frontal lisps. And it does impact how well I could even understand them, especially if they're speaking fast or if they're like turned in another direction, like looking away from me. It's like, I think I heard that what that was, but please repeat that. And, you know, I don't know, but most kids don't like repeating what they told you. They just want to tell you once and move on.
Yes.
Okay, so 3 for lateral, 4 for frontal lisps. That's good to repeat, I think. Okay, so let's move on. If there is a concern and a person gets in for some therapy, what does treatment look like? What could families expect if they came in and saw a speech therapist?
We're really going to assess the structure of their mouth, especially the frenulum, the tissue under their tongue. Also looking at if there's any dentition alignment issues. Sometimes kids can have an anterior open bite, you know, when you see that opening between and maybe the tongue sits between. You might have an overbite, which could impact the placement in the airflow. An underbite as well, if those bottom teeth come out, that's going to impact how the sound is being produced. Possibly even a crossbite. Again, all of that is where that air comes through. So the flow might be distorted or the tongue might be in an incorrect placement because of the alignment there. And you really want to make sure that structure is appropriate for speech function. And then we're also going to talk about the resting position and looking where their tongue is, what their lips are doing and how they're breathing at rest. Again, because that tongue placement is so important. And if that tongue placement is not in the correct spot, elevated with lips closed, breathing through the nose, sometimes that can then impact how we're saying our sounds. And we're going to, of course, do an articulation assessment and just see if there's any other sounds in error as well.
Okay. And then they come and see you like after you've tested them and you're like, yep, you're of this age. Yep, you're making these errors. Is there any like how long does it take, or what kinds of things can we expect? Do you do all the work, or do we do anything at home with our kid? Talk a little bit about that.
Duration is always a tricky one to predict.
Moms want to know, how long am I committed to this?
Yes, totally. It's hard to say. I feel like we like to plan for like a 6-month time frame and then kind of reassess after that. Or if they make really quick progress. It's a lot because it is habitual where that tongue placement should be. It's a lot of homework at home. Like, you're not just going to go to the gym and get muscles. So the tongue is a muscle. So you really have to work on that movement and that placement at home as well as in therapy to be able to generalize that positioning and that correct production.
Okay. But even like knowing 6 months is kind of where we're starting, that seems doable. That seems like we have a goal. That seems like I can hang on and see where we're at there. And I suppose the longer that they've been, like you said, it's a habit. So the longer that they've been practicing that habit, it might take longer to learn a new habit or eradicate that old one and get that tongue where it's supposed to be. Okay, interesting. Okay, my next question for you is talking about private therapy versus therapy in the school. Many people know that when you're in the public school setting, there are speech therapists in that setting as well. Kids get therapy in school. And a lot of families, once their kid is in school, even if they've received private therapy services like Red Door services before that, once they're in school, they sometimes decide to discontinue private services, or if they even haven't had it before, now that they're in school, they think, well, I have it in school. Why would I ever need private therapy if I'm already getting it in school? So talk a little bit about that distinction and what's different about those two settings, and maybe why private therapy would be important?
Yeah, at school, it has to impact your academics, and often it doesn't if it's just that lisp sound coming forward. Typically, private practice, we talked about this a little bit earlier, we have, we're able to work on sounds maybe earlier than they would be able to at school, and we often see kids one-on-one rather than in a group setting at school, and we depending on the number of minutes that they have to have at school, and the different laws and stuff that school has to follow. Sometimes we're able to just see them, for a 30-minute amount of time, one-on-one, and you get more of that direct input than you might somewhere else.
Yeah. Private clinics just have a little bit more freedom to do a little bit more different things. And the individualized, the one-on-one can be really important for kids, especially when they're first establishing that sound, I think, and learning how to make it and then progressing from there. Can families seek services at both places?
Totally. Yes.
Okay. Cool. All right. So another parent question I think that we get a lot is, why? What causes this? Why does my 7-year-old have a lisp and my 5-year-old doesn't? What causes a lisp in my kid?
Yeah, well, we don't always know the cause. Sometimes there's been a history of an oral habit, like a pacifier or thumb sucking beyond 12 months of age, extended bottle use, hard spout sippy cups, sucking on blankets or clothing. All of those things are going to keep the tongue low and forward in the mouth. And so again, we talked about the placement being a habit. So if those persist past a year, then sometimes that tongue doesn't elevate and retract like it should then for those sounds and at rest.
Okay. And you said a year, so like 12 months.
Mm-hmm.
That's sort of when we should be saying goodbye, passy, goodbye, all of the passies, and transition to other things.
I mean, there's some research that even says 6 months for a pacifier. So it just depends. Obviously, each child is different. Sometimes there's medical needs involved. So it's just dependent on each child. But for a good rule, 12 months is a good.
Okay. I think that's going to seem early to people when they hear that age, if they haven't already. If you come to Red Door and have a habit like that, that's still ongoing and happening, is that something that we can work on in therapy with you, or do we have to go that road alone and then come for therapy?
Yeah, we definitely have some things that can help with habit elimination, some tips and some tricks. Everybody has to be on the same page though. So if we're not ready for that yet, then we have to all be ready to do it. And so sometimes do it and sometimes not, because then it's going to still persist. So we have to be ready to kind of break that habit and be.
Yeah. And we'll impact progress. Come in and do therapy and then have the passy at home. It's just going to work against what we're trying to do. So good. Jorden, thank you for sharing all of that today. I did do a little research before just to get some numbers to throw at people, because you're never alone when you have these experiences with your own kids or kids that you have in your family, nieces and nephews as well. Up to 10% of kids have some kind of speech sound disorder at some point. Not all the time do they get in for therapy or even need therapy. Sometimes they go away on their own, but that's often not the case. So those ages that Jorden talked about, 3 and 4, are really important to kind of keep your eye on and come and even get an evaluation. It's great to come in for an evaluation and get told you're on track. Everything's great. Go home, carry on. We do have that happen, and we love to see kids who have typical skills and don't need us. That's okay to do too. And speaking specifically about lisps today, they're one of the most common articulation errors in the world, particularly between those ages of 2 and 5. So don't wait, come and see us. Jorden, thank you so much for spending some time with us today and sharing all of your knowledge about this topic. You're just an expert, and I really appreciate you.
Thanks for having me.
Yes. Okay. Bye, guys. We'll see you next time.
Thanks for unlocking potential with us, and a special thanks to our subscribers. Consider becoming one today. Unlocking Potential is a production of Red Door Pediatric Therapy, with clinics in Fargo, Bismarck, Grand Forks, Minot, and Beulah. Learn more and book your free screening at reddoorpediatric.com.